Hello, I'm Craig Stern of Pharma Pharmaceutical Consultants. We've been talking over the last several weeks about drug cost, about utilization. It's now time to start talking about pharmacy benefits. And the most fundamental part of a pharmacy benefit is formulary. Now the question is, what's a formulary? Why are there issues about it? Why are there issues and people that complain about it? What's going on? This is a rather large topic, but we'll see if we can handle it from the very beginning and see what the issues are and why these issues occur. First issue is, what's a formulary? Actually, formularies are rather old. They were discovered in Egypt, ancient Egypt, on papyrus ebers. So we're talking about something that goes back a very long time. And they effectively had two main formulas that have been done historically. One is they were kind of a cookbook that was used by professional doctors and pharmacists, frequently the same, in order to decide how they were going to mix up a particular brew. And the other is that when drugs began to be manufactured, they became an inventory control kind of option where there was a list of drugs that would be in a hospital or perhaps that would be covered with a particular plan. As managed care began to evolve over the 1980s, 1990s, 2000s, etc., we're dealing with formularies that are about drugs that are manufactured by major pharmaceutical manufacturers all over the world, in the United States and in other parts of the world. And we find that they contain drugs in every therapeutic category. They are based on the demographics of a population. So when you build a formulary, you take a look at the population and you say, okay, what kind of disease patterns do we see here? What's the age and gender of the population? And then we begin to build a formulary around what we need to treat the particular population for the disease pattern. Having said that, we run into a fundamental problem, and that is that every formulary has to have a certain amount of drugs in it, and every category that you might use to treat a given disease needs several drugs, because there may be one drug that people can't tolerate or individuals can't tolerate and another drug that they can. So you try and have at least a mix of a few drugs in that category to ensure that you have it covered for the inter-individual, the inter-patient, and the intra-patient problems that may occur over time. Now, there are certain categories that people have considered to be absolutely crucial. Drugs such as categories of drugs to use to treat epilepsy, frequently drugs for cardiovascular disease, diabetes, etc. And even CMS, the Centers for Medicare and Medicaid Services, have identified that there are certain protected categories, or at least a half a dozen categories that they protect to ensure the fact that all drugs in those categories are covered. Now, we're going to have to address this in multiple ways to talk about how do you include drugs, how do you exclude drugs, how do you deal with coding, because there is a difference in not just having a drug on the formulary, but how you code it. We're going to address that in future lectures. I look forward to talking to you about it. I sincerely wish you a good day.